survival skills. Learning about survival skills. Fractures and sprains. Fractures refers to an injury affecting the skeleton and can be caused by the application of direct and indirect force. The general signs and symptoms are pain at or near the site of injury increased by movement. Movement may be difficult or impossible. Swelling and later bruising of the injured part. Deformity at the site of the fracture. Shock may occur. General first aid that could be given to a person is: check the danger, response, airway, breathing, and the blood circulation of the victim. That is, always control severe bleeding before immobilizing any fractures. Place sufficient padding to support fracture site. Immobilize fracture site. Do not force bones back into the wound. Give proper padding before the patient is shifted to the hospital. Apply ice pack on the affected area to reduce pain and control swelling. Treat to prevent shock. Poisoning. Poisoning is a substance that causes injury, illness, or death when introduced into the body. Ingested poisons are introduced through the mouth by eating or drinking poisonous substances. Inhaled poisons are introduced through the lungs by inhaling industrial gases, fumes from fire, chemical vapors, and petrol and engine exhaust. Absorbed poisons are absorbed through the skin via contact with poisonous sprays such as pesticides and insecticides. Do's. Check the danger, response, airway, breathing, and the blood circulation of the victim. Give milk or water to dilute down the poison. Monitor vital signs and prevent shocks. Observe the amount and color of vomits. Check for foreign matter in his or her mouth and remove it so that he or she can breathe freely. Place the patient in recovery position and wait for medical assistance. Send to hospital. Don'ts. Don't induce vomiting. Heat stroke. It strikes suddenly with very little warning. When the body's cooling system fails, the body temperature rises fast. This creates an emergency condition. The signs are: the temperature of the body is very high, hot and dry. The skin is red with no sweating and fast pulse rate. Dilated pupils. Confusion, and sometimes there might be loss of consciousness. Do's. Lower the body temperature by removing or losing the clothing or fanning the person. Put ice pack or cold compress. Drink lots of fluid, and those who perspire more should drink as much as fluid as possible. Stay away from places that are hot. Information. Oral rehydration solution, that is ORS. ORS has been a lifesaver in case of dehydration, loss of salt and water in the body. The ORS is prepared by dissolving a pinch of salt in a glass of water. The amount of salt added should just be enough for the water to taste like teardrops, and 1 tablespoon of sugar to it. ORS helps in restoring back the electrolyte balance of our body and rehydrate it. You too can now make it at home when you feel you are dehydrated. Dog bite. The aim of first aid in case of dog bite is to prevent rabies, to reduce the risk of infection, and to get medical aid as soon as possible. Wipe the saliva away from the wound using a clean cloth or handkerchief. Do not come in contact with the saliva that gets wiped away. Wash the wound thoroughly with plenty of soap and water. Cover the wound with a dry, sterile dressing. Get medical aid or send the patient to the hospital as soon as possible. That is all in this lesson. It was very interesting to learn about the precautions and measures that has to be taken at the time of different calamities and situations. Always be ready with your first aid kit.